Okay, so we'll go ahead and jump in. So today we're going to be covering the funding opportunity, eligible applicants, the funding description, eligible funding requests, and then going through the application process. The application's based and built around the strategic prevention framework, how to access the application, the sections and components and point values of those parts of the application, and then going through the application submission review and award timeline, and then having an opportunity for Q&A at the end. Okay, so the SFY2027 SUPP grant funding opportunity, on the informational webpage, there's the notice of funding opportunity, and then there's also an application guide that has really detailed guidance on how to access the application in Neighborly, how to collaborate on an application, if you want to have more than one individual use it, how to save your work, and continue and go back to the application and work on it as you go throughout the application period, how to print the application if you want to print off different sections and whatnot. So a lot of resources in the application guide, as well as other resources on the strategic prevention framework and whatnot. So all of this information on the funding opportunity and these resources related to it are on that website. The website URL is the same as it's always been. It's prevention.odp.idaho.gov. And then our substance abuse block grant application information webpage will be going to that webpage at the end of the webinar, just to show you guys where it is and where all these resources are located on it. But that's a little context on that. Eligible applicants for the 2027 SUPP funding opportunity include any public or governmental entity, including tribal entities such as counties, cities, schools, school districts, libraries, etc., as well as nonprofit entities such as community-based organizations, behavioral health nonprofits, coalitions, and youth and family serving organizations. Federal regulations prohibit the awarding of any SUPP funds or the block grant funds to any entity other than a public or nonprofit entity. So for the funding description, the SUPP grant is funded through the Substance Use Prevention Treatment Recovery Services Block Grant, as I mentioned earlier, which is referred to as the SUPTERS Block Grant, or previously, a few years ago, it was also called the SUBG or the SUB or the SABG. It's fallen under a bunch of different names. At the federal level, currently it's called the SUPTERS Block Grant, Substance Use Prevention Treatment Recovery Services Block Grant. And it's a federally appropriated block grant that's awarded to the state of Idaho by the Substance Abuse and Mental Health Services Administration, or SAMHSA, which is a federal entity within the U.S. Department of Health and Human Services. The purpose of the SUPP grant funding is to support organizations and agencies with the implementation of evidence-informed, community-driven primary prevention programs and strategies that are designed to address specific, locally identified drug and alcohol-related challenges at the state, county, community levels. Just a note to throw on there that ODP is a government entity, and our grant awards are contingent upon funds appropriated by the federal funding agencies, the Idaho legislature, funds granted by the federal government, or both. And that's a note we started including in our grant agreements and our contracts. And I figured I'd mention here this year, because over the last year, funding has gotten federal funding has gotten a little bit more unstable. I don't know if any of you guys or organizations that have experienced that. Though I will note that the funding for this grant comes from a block grant, or the SUPTERS block grant. Block grants are much more stable, reliable sources of funding. So in regard to, if you feel confident, if you were to apply for funding and receive funding from the block grant, you can feel pretty confident that you're going to get that funding regardless of what's going on at the federal level. The grants that are a little bit more uneasy at this point in time are the discretionary grants. And ODP also manages one of those. It's a partner. It's called the Strategic Prevention Framework Partnerships for Success Grant. And that's a federal discretionary grant that we receive. And with that grant, we fund two different funding opportunities. One is a kind of a community-based community coalition activities grant, and then also a law enforcement grant. And if you guys are ever curious about either of those funding opportunities, you can feel free to reach out. But yeah, it's a little bit of context around the block grant and the stability of this funding. So the SUPP grant, given its name, the Substance Use Primary Prevention Grant, as I mentioned, that SUPTERS block grant that comes to Idaho, it technically comes to the Department of Health and Welfare. And then in statute, 20% of that block grant has to be spent on primary prevention strategies. That 20% comes to our office. Primary prevention programs and strategies are directed at individuals that are not identified as in need of treatment. And it involves activities that shift focus upstream to educate and support individuals and communities to prevent drug and alcohol misuse and the development of substance use disorders. So yeah, thinking with this funding opportunity, it's very much upstream, looking at risk and protective factors, and focusing on, delaying the initiation of youth substance use and then preventing substance misuse behaviors from occurring and hopefully ultimately preventing substance use disorders from developing. Once you get beyond primary prevention into more of an intervention, treatment, recovery space, that funding is all managed by the Department of Health and Welfare, and treatment recovery activities are not eligible to be funded under this specific funding opportunity. Applications or eligible applications will propose efforts and activities that focus on the implementation of evidence-based, evidence-informed, or promising programs and practices that align with one or more of the SAMHSA Center for Substance Abuse Prevention 6 identified prevention strategies, which include prevention education programs, positive alternatives, information dissemination, community-based processes, environmental strategies, and problem identification and referral. And we'll go through those in more depth later in the application. Okay, so eligible funding requests. Eligible funding proposals will utilize the application to do 4 primary things. One is identify the substance misuse problems and the related harmful behaviors that are being experienced locally. You'll determine the perceived root causes of those issues, the risk factors and protective factors associated with those identified substance misuse problems, and you'll provide supporting data that substantiates the existence of these problems, their causes, and their associated factors. And that will all be kind of primarily built out in the community needs assessment section of the application, and we'll be going through the application sections in a little bit. Number 2, you will utilize the application to propose evidence-based, evidence-formed, and promising programs and practices. All proposed activities must be based on and guided by sound principles of prevention science, or principles that have been demonstrated through evaluations to effectively reduce risk factors, enhance protective factors, and achieve the desired outcomes of delaying youth initiation of substance use and preventing substance misuse behaviors in the onset of substance use disorders. So kind of piece number 1 is you're going to be utilizing the application to really identify the substance use issues you're seeing in your community or the risk and protective factors you're seeing in your community. And then number 2 is you're going to pick programs and activities or identify programs and activities to address those problems, risk factors, whatnot that you've identified. 3 is you're going to justify your activity selection. Once you have identified the substance misuse problems experienced locally and selected the prevention activity or activities that you're requesting funding to implement, you will need to provide justification as to why the activities that you selected will address the identified substance misuse problems in your community. Why are the programs and activities that you're proposing to implement a good fit to address the identified substance misuse challenges in your community with your population? And then lastly, you'll provide detailed staff mileage and other budgets for each of the key prevention activities that you request funding to implement. So the SUPP grant award provides funding in 3 budget categories. 1 is staff, all staff costs related to the program implementation. 2 is mileage, so any mileage expenses related to program implementation. And 3 is other, so all costs for program like supplies, materials, curriculum, any of those things required for program implementation. So you'll have to break out your requested funding in those 3 budgets for each activity that you request funding to implement. So eligible program activity standards. To be eligible for funding, proposed prevention programs and activities must kind of have 2 things in mind when you're selecting them. They must be based on and guided by sound principles of prevention science. So like I mentioned earlier, those are principles that have been demonstrated through evaluations to reduce risk factors, enhance protective factors, and achieve those desired outcomes of delaying youth initiation of substance use and preventing substance misuse behaviors. Just very important that we support programs and activities that are guided by science, that we have more confidence that through outcome evaluation, they have been demonstrated that if they are implemented effectively, they are likely to have desired positive outcomes, and also ensure that we are not going to be accidentally causing any unintentional harm. And then B, the proposed prevention programs and activities must fall under one or more of the 6 SAMHSA CSAP prevention strategies. So the 6 CSAP prevention strategies, additional information and program examples can be found in the application guide, and then also in the SAMHSA resource focused on prevention strategies and programs to prevent substance use. So those resources are linked here in the PowerPoint, but then also they're detailed in the application guide, which is housed on that application information website. So those 6 CSAP strategies are direct service prevention education programs. These focus on interactive two-way communication between facilitators and participants of evidence-informed direct service programs and curriculums that are aimed at increasing knowledge and improving critical life and social skills to prevent substance misuse. Number 2, positive alternatives. These programs and activities focus on providing activities that exclude alcohol and drug use to offer constructive and healthy alternatives to substance use, and particularly for youth and other at-risk populations. These activities are designed to reduce risk-taking behaviors, reinforce protective factors, and promote mental wellness. And then number 3, community-based processes. These focus on enhancing the ability of the community to more effectively implement prevention efforts by strengthening resources such as community coalitions to prevent substance use and misuse. Organizing, planning, and networking are included in this strategy to increase the community's ability to implement effective prevention services. One second. I just want to double check something on my screen. Number 4, environmental strategies. These focus on the setting and conditions in which people live, work, and socialize to influence the broader population rather than targeting individuals directly. These strategies aim to change the norms, conditions, and policies within communities to reduce risk factors and increase protective factors associated with substance misuse. Number 5, information dissemination. Focuses on increasing awareness and knowledge and changing attitudes about substance misuse and its effect on individuals, families, and communities. It's characterized by one-way communication from the source to the audience with minimal interaction between the two. This strategy also promotes awareness of available prevention programs and services. So information dissemination, think things like media campaigns and public service announcements. And then lastly is problem identification and referral. This one focuses on identifying individuals that either have risk factors that make them high risk for substance misuse or that have already engaged in substance misuse, and determining if their behavior requires prevention, education, or other interventions. So like I mentioned, the application guide goes through each of these 6 CSAP strategies, again, in depth, and then also provides examples of programs and activities that would fall under each of these. And then the second part of the eligible programs is that all proposed strategies must be based on sound principles of prevention science, principles that have been demonstrated through evaluations to effectively reduce those risk factors, enhance protective factors, and achieve those desired outcomes. Please note, so the desired outcomes of delaying youth substance use initiation and or preventing substance misuse behaviors, that's among any identified age group or population. A lot of our subgrant awards do focus on youth-focused programming. We also fund a lot of family-focused and parent-focused programming as well. But programs do not have to focus on youth or parents or families specifically to receive funding. It can focus on any identified age group or population. It can focus on seniors or veterans or college-age population. We can focus on any of those. It is not required to be youth-focused specifically. And then up here on the screen, I have a list of ODP resources, SAMHSA resources, and then additional evidence-based program registries and resources. I built out this list a lot more this year. I feel like every year I'm adding a little bit more to it. The ODP resources have remained the same. We have our evidence-based practices dashboard, and then we have a evidence-based practice selection and planning workbook, and then we also have a prevention resource library. SAMHSA resources have kind of stayed the same, but those are always helpful to look at, particularly selecting best fit programs and practices. So if you're wondering how to pick a program that's a good fit for your population and the issues you're experiencing, great resource. And then they also have resources on finding evidence-based programs and practices. And the last one in that section, the focus on prevention, the strategies and programs to prevent substance misuse, that's a great resource as well. And then the third category, the additional evidence-based programs and registries and resources. I think that I would recommend checking these out. I think it's interesting. I love when I can find another state's resources on different evidence-based programs that they have on their registries. Idaho has the evidence-based practices dashboard that we have worked with the state epidemiological outcomes work group to kind of build out, but there are a lot of different programs out there. We haven't, scoured and necessarily found all of them and been able to review all of them. So if you look through these different resources and you find a framework or a program that you think looks interesting, you can definitely request funding to implement it. And all of these resources listed there have someone's in the waiting room, have a lot of great information. So I would recommend kind of checking these out. And a lot of these registries have filters where you can filter by age, by program setting, things like school-based or community-based or whatnot. And then, different specific substance use issues or risk factors, protective factors that you're wanting your program to focus on. So I have added a lot more resources to that part of this, the presentation and the application guide this year. So recommend checking those out, and hopefully these are helpful as you're completing the application and you're trying to consider what programs you should request funding for to implement in your communities. All of these, they're hyperlinked in the PowerPoint, but they're also all hyperlinked and outlined in the application guide as well. Okay, so moving on to the 2027 SUPP grant application process. So some resources I have up on the screen. There's that SUPP grant application information website that we'll go to later on in the webinar. But then we have this application guide. It's a very helpful resource. I'm not actually going to go on to Neighborly and go through the application step by step like I have before, because the application guide really does that really thoroughly. So we'll go through the application guide briefly, but I think that's a really helpful resource. I try to really build it out every year and make it as valuable as possible. So highly recommend applicants look that over before they work on the application. Even if you've done the application before and you know how to do it quite well, I update this application guide every year, so it always has some new helpful information in there. And then also on the screen here, this is a screenshot of the sign-in page when you go to log into Neighborly, which all of our grants are managed. The application, award, and management process is all housed on Neighborly. It's a grant management platform that we have contracted with for, I think this is our 5th year. And so more information on Neighborly, how to create an account, how to access the application in Neighborly and whatnot, that's all detailed in the application guide. But yeah, you will log into Neighborly, access the application, complete the application online, and submit it online. And then lastly, this is just the guide to SAMHSA's strategic prevention framework, which is a helpful resource for people to look through to get a better understanding of the SPF model. So the strategic prevention framework, the grant application follows the SPF framework, which is a community engagement model developed by SAMHSA to provide prevention planners with a comprehensive approach to understanding and addressing the substance misuse problems in their states and communities. So the SPF follows 5 steps. You start off with assessment, kind of assessing the needs, issues, whatnot in your community, then looking at the capacity of your community, of your organization to address issues. Then you move into planning, proposed programs and activities, and then implementation, and then evaluation. And it's kind of a constant cycle. And then while you go through that cycle, there's these 2 guiding principles of sustainability and cultural competence. So some resources on the SPF are up there on the screen. These are also in the application guide. I think they might be in the funding opportunity announcement as well, but they're hyperlinked in multiple places, so you'll be able to find them. One is the Strategic Prevention Framework, SAMHSA's Strategic Prevention Technical Assistance Center. They have some great information on their website. And then there's that guide to SAMHSA's Strategic Prevention Framework, and then the focus on prevention. Strategies and Programs to Prevent Substance Misuse. Those are some great resources to learn more about the SPF. So when we move into the application sections and the point values of these different sections, you'll see how the sections really align with that SPF. So section A is organization information. This is where you'll provide, information on your organization, your address, what region you're in, your primary point of contact, if you have a fiscal agent, if so, their contact information. And then you'll move into community needs assessment. This has a 20-point value, and the questions within the community needs assessment and the points per question are really broken out in the application guide. So we can go through that in a little bit, and that will provide more context on that. And then section C, capacity building. D through H is the program planning, implementation, and budget section for up to 5 programs. And then you go into evaluation, and then sustainability and cultural competence. And then we have a section for additional documentation. And then lastly, there's assurances and conditions agreement, and then you will sign and submit the application. So one thing to note, you'll see up here on the screen that sections D through H are for program planning, implementation, and budget. These sections are worth 80 points total for all programs. So in the application, organizations can request funding for 1 to 5 different prevention activities. The number of activities that an applicant requests funding for will not have an impact on the likelihood of being awarded funding. Rather, award decisions will be based on the quality of the proposal and the availability of funds. So whether you request funding to do 1 program or 5 programs, you still are eligible for 80 points total, and that point value and how it's allocated is based on the quality of the responses, regardless of how many programs you actually request funding to implement. So you don't get bonus points for requesting funding to do more activities. And I just realized that I accidentally had this slide in there twice. So sorry about that. This one is the exact same, but this is the slide I intended to include. And that's because down here at the bottom, it says additional details on each section can be found in the application guide. So application tips. This is a screenshot from page 19 in the application guide because I go through or provided more context on these tips in that guide, and it would have taken up a bunch of slides to try to provide these details slide by slide. And I just want to kind of keep referencing people or directing people back to the application guide because it is a very helpful resource. But basically, some application tips we have when completing this application. For the entire application, we recommend that applicants review the key resources prior to starting, while completing the application, to get a thorough understanding of the funding opportunity of the SPF model, of evidence-informed programs and activities. Those key resources include the funding opportunity announcement, the SAMHSA's Guide to Strategic Prevention Framework, and that focus on prevention resource, the strategies and programs to prevent substance use. And also, we recommend that applicants review other resources provided throughout the application. So the resources and registries for finding evidence-based, evidence-informed, and promising programs and practices, which is on page 9 of the application guide. And then ODP hyperlinked throughout the entire application. Wherever I've tried to hyperlink resources in there, wherever I think it could be helpful. So when you are asked to provide data in some way, shape, or form in the application, I will have in the application hyperlinked ODP's publication and data sources page, which I recently updated. So that's a really great resource. And then we also have hyperlinked in there a review of the IOM category definitions. I also found this resource this year. It's called Engage Evidence-Based Strategies to Prevent Youth Substance Use. That's hyperlinked within there. Selecting best fit programs and practices. We've tried to provide a lot of resources and support throughout the application, but also in the funding opportunity application guide. So, if you see a hyperlink, maybe click on it, look through the resource. It could be helpful. That would be a recommendation on our end. And be sure to thoroughly read the questions and the prompts in each section and fully address them in your responses. For example, in the community needs assessment, if the application asks you to provide a kind of context on the demographics, what is it like to live and work in your community, really try to fully address that question. Read the prompt and fully address it and whatnot. and keep that in mind as you go through the application. Like if you're asked to provide an activity description or an action plan or a justification, really try to fully address it. And we also encourage applicants to have someone proofread your application and double check your math calculations prior to submission to help catch spelling errors and mistakes. Sorry, someone else was in the waiting room. Okay. Then with the organization information section, one area where applicants often get caught up is they are asked to provide the public health region that their organization falls under. And oftentimes they will get that region incorrect in the application. And then also in the application guide, there's a link to the Department of Health and Welfare has a public health district map. So you can check that. And we recommend you double check that just to make sure you got it correct. For the community needs assessment, fully answer and address the questions and prompts, use relevant, timely data, and use resources from ODP's publication data sources webpage if helpful. Under the causes and factors in the community needs assessment, consider and discuss the risk factors and protective factors associated with your identified substance misuse problems. And program planning, implementation, and budget section. So look at the resources that are available to do your best to select the correct prevention strategy or CSEP prevention strategy, and then also the IOM category that the proposed program activity falls under. Review the strategy and IOM category resources provided in the application guide, and then they're also linked in the application itself. And under strategy and program justification, clearly explain why the chosen program or activity is the best fit for your community needs and the identified substance misuse problems and the population the program will be implemented with. So again, why is this the best program to address these identified substance misuse issues in your community with these specific populations? And under activity description and action plan, so in each of those sections, D through H, when you request funding for 1 to 5 different programs, you will be asked to provide an activity description and an action plan. Clearly outline the action plan to implement the proposed program. This is the who, the what, the where, the when, and the how you're going to be implementing this program. When is it going to start? When's it going to end? How many sessions are you going to do? That information, where is it going to be based, whatnot, is all very helpful for the review committee and ODP to have a good understanding of what exactly you are planning to do, and also give confidence to the review committee that you have a clear idea of if you receive funding, you know exactly how you're going to successfully implement this program. And provide detailed budget justifications that clearly explain how the requested budget items are necessary for the proposed program. So if you're requesting funding for 3 staff, being able to clearly explain how those staff are going to be involved in the program implementation and how these hours and whatnot are necessary for them to be able to successfully complete their role as they are involved in the program. And then also with mileage, clearly explaining if you're requesting funding for mileage, why the travel is necessary, how it's involved in the program implementation. And then with the other budget, this includes things like, supply costs, materials, curriculum, space, all of those different things, being able to explain how these different costs are associated with program implementation are necessary and required for it to be able to be successful. Those budget justifications are very helpful when budget is tight. We historically have received a lot more funding requested than we have available. And so the review committee has to often go through applications and be very thorough and thinking, okay, what can we fund? What can't we fund? What is, how can we fund as many programs or activities as possible? And so how can we be as selective in when we're choosing what line items to fund so we have the most funding available to cover different proposals? So having that clear activity justification or those budget justifications helps the review committee have a better understanding of why you're requesting this funding and why it's necessary. And then the next section is evaluation, clearly outlining what outcomes you anticipate your proposed programs to make in your community, sharing how you plan to measure the impacts and outcomes of your proposed programs, and or your commitment to utilizing evaluation methods to measure outcomes. If you've previously administered primary prevention programs or received ODP funding in the past, share any quantitative or qualitative outcomes you have from those activities. And we just got back our SFY2025 provider level evaluations from our evaluation services contractor last week. So I will be sharing those provider reports with our grantees that received and implemented funding programs in 2020, SFY 2025. I'll be sharing those out with you guys this week so you can utilize that in your application. And then lastly is sustainability and cultural competence. With these, a recommendation is always think bigger than the bare minimum. I think oftentimes people can fall into the trap of with sustainability, saying something very kind of bare bones like we're going to fundraise. That's great, and it is something to keep in mind for sustainability. But thinking more of what's bigger, how are you going to fundraise? Are you going to work with your community partners to fundraise? How applying for grants and working with without your network and whatnot, just going a little bit beyond to make it seem like you actually you not only do you want to fundraise, but you actually have a plan for how you're going to fundraise. Explain how your organization plans to maintain the human, the structural, the financial, and other resources to sustain your efforts in the future. And explain how your organization plans to ensure your programming is accessible to individuals in your community that are across the socioeconomic, religious, and cultural spectrum. So for sustainability and cultural competence, applicants will be asked to provide 3 actions that they will take for both sustainability and then for cultural competence to ensure sustainability and cultural competence. I think oftentimes applicants can get hung up when looking at cultural competence, can maybe get hung up of just thinking, okay, well, this just has to be maybe focused on different like race groups or ethnic groups or whatnot in our community. So focusing just on that. But cultural competence can be broader, thinking of the kind of broader cultural aspects of your community, beyond just race and ethnicity, but also in minority populations, which are very important, but also it can cover things like what are different socioeconomic groups? How are you going to make sure your program is accessible to individuals of low income? If you're doing an adult focused program, how do you make sure it's accessible to low income individuals or single parents who might not have the funds to cover childcare costs? Or you can even look at different faith-based groups or different things like that. So it can be broader than oftentimes what applicants will think when they first look at that. Okay, so the 2027 grant timeline. So the application opened on February 11th. It will close on March 23rd. And the review period is March 24th through May 31st. And then grant recipients will be notified on June 1st, 2026. And then the grant award period will be state fiscal year 2027, which is July 1st, 2026 through June 30th, 2027. So our grants operate on a 1-year and 12-month period that aligns with the state fiscal year. And regarding kind of the application period, the February 11th through March 23rd, your applications, once you start an application, you can save your progress as you go and work on it throughout the application period. And all the information on how to do that can be found in that application guide. So here's 2 key links for you guys when you're going to be doing the application. Neighborly, this is the link to the Neighborly portal. So if you have applied for or received funding from us in the past, then you already have an account. That's great. You'll go to that link and you'll log in like you have historically. And then the application will be on your dashboard. Under the dashboard will have these different sections, like if you have a grant with us currently or you have a previous grant or whatnot. But there will be, starting a new application, and this application opportunity will be listed underneath in that section on your dashboard. So that's the link you'll use. If you haven't requested or received funding from us in the past, you will just have to sign up for a Neighborly account. It's very easy. There's guidance in the application guide on how to do that, but you'll sign up for an account. You then have to get an email to verify your account, and then you can log in and the application will be visible on your dashboard. And then the other link is the application webpage. So this is a great, very helpful resource. It's where we house the funding opportunity announcement, the application guide. The Neighborly link is also on there and other application resources. So I'm just going to go ahead and open the application webpage. Okay. Are you guys all seeing the SUPP grant application information webpage now? You can throw a thumbs up out there just to make sure I can see it, or that you can see it. Should be able to.
Yes.
Awesome. Thanks, Holly. Great. So this is the application information webpage. This is housed on ODP's prevention website. We have two websites. One is our odp.idaho.gov, which is this is more of our public-facing website with information on substances and whatnot. Also a great website, and we actually just updated it last year, so it's a little bit prettier than our prevention website, but this is much more of our public-facing one. Then prevention.odp.idaho.gov is our kind of webpage focused and geared towards our grantees and our prevention partners. So on this page, there's ODP grant resources and then the grant information webpage. And so this is where it has all the information, funding opportunity announcement. Find that here. More information on the funding description, application submission, neighborly. That. And then for additional support, applicants can find detailed application guidance instructions in the application guide. So I want to open this up. So this is a very helpful resource that I've really tried to build out, and I want to keep directing people to it so that you know it's there. So it goes through registering an account and accessing your grant portal. So how to access Neighborly and the grant application portal, signing up for a Neighborly account, how to do that, accessing the 2027 grant program application, so how to start a new application, saving your progress and continuing work on an existing application as you go throughout the application period, and then printing and collaborating on an application. We also it has an application overview and information on the strategic prevention framework, and then it goes through each of the application sections. So section A, organization information, section B, community needs assessment, and links for more information on this section. Things are hyperlinked within here, and then goes over every question within this section: demographics, substance misuse problems, causes and factors, current efforts, resources, and readiness. And then hyperlinked within here are resources for data sources, information on risk and protective factors. All of this is very helpful, and just highly recommend that you read through this before and or while you're completing your application. It's very helpful. And then section C, capacity building, or at least I hope it's helpful. If it could be more helpful, let me know. I'm happy to make updates to it. And so capacity building, organization information, the CPS and PPS credentials. And I also in here, it clearly outlines the point value for each of these questions within each section. So it's a little bit more detailed even when kind of explaining the point values that are associated with these different sections. And then how to, complete each question. So with organization coordination, when you need to add in a new partner, you can add a row and whatnot. Very helpful. Program 1, planning, implementation, and budget. You will identify the substance misuse problems and root causes related to the programs that you're requesting, specifically in Program 1. And then you will pick your program strategy and IOM category selection. And here's all those resources on the evidence-based, evidence-informed, promising programs and practices. Strategy selection, much more detailed information on those CSAP strategies, as well as examples of activities within each CSAP strategy. So it'd be great. I highly recommend you looking through here if you're wanting to get more context on those CSAPs and what specific programs or activities fall within each one. IOM category, or the Institute of Medicine category selection. We didn't really talk about this earlier in the PowerPoint, but applicants will be expected to identify which IOM category their program or activity falls under. When we report at the federal level, we have to report to SAMHSA by IOM category. So we have to kind of keep track of the IOM category and what programs or activities our subgrantees are doing within those IOM categories. So resources, there's a lot of resources in here to help you learn more about those, what an IOM categories are. and how to make sure you pick the right one. Sorry. Okay. Ultimately, the Institute of Medicine, or IOM model classifications, often referred to as a continuum of care, categorizes the prevention interventions according to their population focus. So these are universal, and universal is broken out into two more specific categories, or universal indirect, which is individual initiatives that support kind of population-based programs and strategies. So doing much more broader, think like higher reach but lower touch. Like you're reaching more individuals, but at a much lower touch. Like a media campaign, you might reach more people with a message one time, versus universal direct, which are interventions directly to serve an entire group of participants that haven't been necessarily identified as having a risk factor for substance abuse, but say you're doing a program with all fourth grade students in your school district, that would be universal direct, where you're reaching all of the fourth grade students, not just the ones who are identified as having a higher risk factor. So you might be reaching a smaller group than universal indirect, but you're doing a much more higher touch. So you're doing a program with fourth grade students where you do 5 sessions of direct service programming with them. And again, there's examples kind of highlighted throughout here to kind of help you with that. Selective IOM category is activities that are implemented with individuals or a subgroup of the population whose risk factors of developing a substance disorder is higher than average because of an underlying risk factor. And then indicated are activities that you implement focused on individuals who don't meet the criteria for substance abuse or dependence, but who are showing early danger signs such as failing grades, consumption of alcohol and other gateway drugs, and whatnot. So that's more information on that. Then strategy and program justification. I mentioned this a couple times. You'll have to pick a program and then explain, kind of justify why you chose that program. And this is more context on that, as well as resources on where to find information when you're trying to think about what data or qualitative or quantitative content could be helpful when completing that program justification. For program implementation, you're going to have to do activity description and action plan. And if you're doing a direct service program, providing context on implementation fidelity, how you're going to implement that program as intended to ensure outcomes, positive outcomes. And then you go into budget, and this is all within. So there's sections D through H. Each of those sections, D, H, C, D, E, F, G, D through H, are program 1, program 2, program 3, program 4, and program 5. So program 1 or section D will have program planning, implementation, and budget for program 1. And then when you go into the next section, that would be for program 2, and that would be then planning, implementation, and budget for program 2. As I mentioned earlier, the SUPP grant provides funding in those 3 budget categories of staff, mileage, and other. So the application guide takes you through the process of how to complete the staff budget table, and then the budget justification, as well as for mileage and the other budget. And then how to enter in your total request at the bottom of that section. And then since sections E through H for planning, implementation, and budget for programs 2 through 5, they are identical. So all of those sections, D through H, are identical. It's just changes for programs 1, 2, 3, 4, or 5. So the application guide doesn't go through each of those sections since they're all identical. All the information provided for section D and program 1 is applicable. But if you don't wish to request funding for programs 2, 3, 4, or 5, you will just leave that section blank. You'll scroll to the bottom of the page and you'll click complete and continue to move on to the next section. And then lastly, or I guess next, is evaluation. In the evaluation section, applicants will be asked to describe the difference you expect your proposed programs to make in your community, consider the problems and root causes previously identified and how you think the implementation of the programs or activities you've selected will fit your community's needs, and share what evaluation tools and methods you plan to utilize to measure the program impacts and outcomes. And then the second question will be, if applicable, it's not required, please share if you've implemented prevention efforts in the past, and if so, did you have any form of process or outcome evaluation to understand the outcomes? Did the efforts produce positive results? And if available, sharing some outcome data. Then some more context on sustainability and cultural competence, where you'll have to provide those 3 actions for sustainability and cultural competence. And then details on the additional documentation. And additional documentation has no point value. It's something we added in last year just to gather some of that documentation that if awarded, applicants will need to, or if awarded, some grant recipients will need to provide, gathering some of that upfront. Then the application guide also goes through the assurances and conditions that applicants will have to agree to in order to submit their application. And then it has guidance on how to successfully submit your application, and you'll electronically sign and submit it. And then again, lastly, those application tips that we went through earlier with all those hyperlinks. So that is linked here. After this recording, I'll have to download it onto my computer and then upload it into YouTube. And it can take a little while, but hopefully in the next couple of days, I will be able to get that all processed. And then the PowerPoint of the slides and the recording will be housed here. Currently, I have the 2026 applications, PowerPoint slides and webinar recording housed here, but I'm going to replace those and then also sending this out in an email. So yeah, I guess I'll also throw out there, one of the things that's highlighted throughout the application guide and in the application itself, there's a hyperlink to ODP's publication data sources. This is a web page. I mentioned that I recently updated this, and hopefully it's helpful to you guys. I really tried to think about different resources when you guys are identifying substance use issues in your community, places that could help provide valuable information. We have the State Epidemiological Outcomes Work Group, the Idaho Statistical Analysis Center that's based in, housed in Idaho State Police. That's great. Reports on school resource officers, reports and statistics and publications from Health and Welfare, Idaho Transportation Department. They track a lot of crash data. So crash data involving underage drinking or just alcohol consumption in general. ISAC, the Idaho Statistical Analysis Center, tracks like all kinds of arrest data and whatnot. Really tried to pull as much helpful resources as I could for you guys. And then I broke it out by publications and then also by data dashboards. So these are all some really great data dashboards that I was able to find. Even things like the Idaho Board of Pharmacy, they track prescription rates by regions in the state and by age group and whatnot. So you could look at, you can find out which in your region, you know, the rate, the prevalence of, I think it's even at the county level. Just click on it and check it out. There's just a lot of really great data out there. But you can see the number of prescriptions filled, and you can, you know, change it by category, opioids, stimulants, and you can see like at the county level. So you can actually see which counties have higher rates of opioid prescriptions being dispensed. And then you can see by age group. So that's helpful. There's also Idaho Department of Health and Welfare has this great, it's called Get Healthy Idaho. All kinds, like you have to, you know, make sure you scroll through it, but all kinds of different resources. Idaho Behavioral Risk Factor Surveillance System. There's one down here that's particularly relevant. Adverse childhood experiences. That could be really helpful when you guys are looking at some of the risk and protective factors. We have, this website houses a lot of different stuff. It's quite valuable. So definitely recommend alcohol and the impact on Idaho's health. You can actually look at crashes, mortality, emergency department visits, outlet density maps. Really cool. So also recommend this one. They also have a great drug overdose prevention program, has a great dashboard on overdose data. You can look at it by fentanyls, opioid, emergency department visits, all kinds of stuff. Just go deaths. So yeah, I think these are great. You can look at overdose deaths by age group, by drug type, in your county, in your region. So hopefully you guys, I would strongly recommend checking out this data sources, publications and data sources webpage. and looking through these resources. There's a lot of great stuff on there. And then I also have these national data tools and publication resources. So not as specific as the state and local level, but also great data sources when you guys are trying to find some data. So I think that's everything I have there. I see there might be a question in the chat. Awesome. Oh, cool. Okay. And that is everything that I have for you guys. Hopefully it was helpful. In the past, I know sometimes I've gone through Neighborly, but I think the application guide is such a great resource that takes you step by step through Neighborly and the application. That hopefully, going through all of that gives you some more context and make sure you have that resource